Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health. Hello again, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me today is Dr. Hollan Harper, a doctor of osteopathic medicine. I said it right the first time. I'm so proud of myself. You know how long I practiced that? It's such a I did. And also, Dr. Harper, your nurse practitioner, Kaleh Knutson. Welcome. Thank you guys coming in and doing this today.
Yeah.
Yeah, you bet. Let's talk. We're going to talk a lot about, here in a few minutes, the Ortho Express, but let's get some background on you guys first, obviously. Mm-hmm. So, Dr. Harper, you come from the Pacific Northwest, from what I understand.
Yeah, Washington State, raised there. And then decided to go east for medical school, and then I did actually my family residency here in Rapid City.
Okay.
And then decided to go down to Texas and do sports medicine training, interventional spine training, lots of different things down there.
So why did you decide to settle out here then
So my wife's from Missouri, I'm from Washington. It's like a good middle portion.
You've been through the winters here though, right?
Yeah, but we don't want to live next to family. They're crazy. So.
Well, that's true. Well, what about, Kaleh, you're Wyoming then, so you're family in essence out here. What part of Wyoming are you from?
Sheridan, Wyoming. Lived a little bit in Gillette, but high school in Sheridan and nursing school in Gillette.
So then did you just end up here because of proximity or family or that kind of same thing, or?
Both. I actually did a couple travel nurse assignments out here and then decided to join the family medicine residency as a nurse and did some family practice and then went back to nurse practitioner school.
So where have you done some other traveling nurse stuff around the country then? I mean, while COVID was going on and everything and they were needing help, and were you doing stuff like that?
So I travel nurse back like 2016, 2017.
Oh.
So a little while ago. And I really just made it to Montana and South Dakota. So
all right.
Didn't make it very far, but Midwest, so.
Yeah, I mean,
Midwest best.
Oh, very good. Yes, very well said. Let's talk a little bit about kind of what your interests are, Dr. Harper, when it comes to your practice, right? You had listed on here, and the one that I'm always kind of interested in, you had image-guided procedures,
yes,
which we can talk about a little bit. You had regenerative medicine. Explain that one a little bit.
Yeah, I think regenerative medicine kind of is a little bit of a misnomer. What it is essentially, platelet-rich plasma, stem cells, those types of interventions. And is it regenerating? It's kind of out. The jury's still out.
Sure.
So I do a lot of platelet-rich plasma, which is essentially taking blood from a patient, using a centrifuge, spinning it down, and essentially getting the good healing factors, growth factors, and platelets, and then using that in an area that either has pain, damage, or needs some healing.
So that can have an effect on stuff when we talk about tendons and things
Very
like
much
that.
so.
That actually can work. No kidding.
Yeah, and a lot of the time studies have really shown it's going to be fantastic at pain, really modifying pain. Because when you have an injury, you've got inflammation, you've got bad players, and the PRP is essentially a good player. Okay. And you can really help people control their discomfort, and there's individuals that have a great response. Now, not everyone's going to respond to PRP, and it's not covered by insurance, so this is not something that I typically offer everyone. So it's very patient dependent.
Well, I was going to say, when they come in and you're evaluating, then that's how you're going to make your decision. And then it says here you take this holistic approach as well to musculoskeletal care.
Right.
Explain that a little bit.
So in my training in medical school as a DO or doctor of osteopathic medicine, there's a little bit difference in training compared to the MDs.
That was going to be one of my next questions, what the difference is between the two. Yeah.
So in our training in medical school, we have a lot of hands-on manipulation training. So musculoskeletal system, alignment, making sure that the body is functioning together as a unit. So if there's an issue where people have an injury, then sometimes that injury causes other areas in the body to have compensation and other areas of pain. So we can look at the body kind of in a whole, unit and then say, well, let's fix some of the muscle here and realign this, and then that might help the area that is painful.
Now that must come into play because you're also one of the team physicians for the Hard Rockers as well.
Right.
Correct?
Yes.
So that must come into play, the holistic part of it.
For sure.
Quite a bit for sports medicine, doesn't it?
I can't tell you how many times they come off the field and, they got hit. There's a rib out, you need to push it back in, or there's an ankle that, is tweaked and you just need to adjust it slightly. And, that's a really good tool to do some muscle treatment to get them back into the sport quickly.
Okay. One other real quick little tidbit I came across while I was kind of looking into some of this for today. Something that was called manual medicine is part of treatment.
Right.
Can you explain that to me too?
So a lot of people view it essentially as a little chiropractic. Are you adjusting? Are you manipulating muscles? And so there's some manipulation where people have pain and their muscles are achy, or there's an alignment issue with the spine. And I adjust people. I work on muscles. I see frequent where people just need some, massage therapy. So I'm trained in that as well.
Oh, I see. Okay.
Yeah.
Well, you're doing it all here. Okay. I thought it was really interesting too that one of your outside interests is carpentry and woodwork.
Yeah.
And I got to thinking, man, that really plays into exactly kind of what your job is too.
Yeah, exactly.
So can you get away from it? Can you relax at all, Dr. Harper? I guess
if you ask my wife, there's like 8 projects going on in my house right now. Kitchen, mudroom, trim, everything like that. I just tell people that I have an adult form of ADD that I treat with projects and work.
Perfect.
So.
All right.
Jokes.
Right. Dad jokes.
Yeah.
For sure.
Well, what's your best one? Do you have a good one? I want to put you on the spot right now. Go ahead. Go for it.
You got it. What lies at the bottom of the ocean and twitches?
Okay, I don't know.
A nervous wreck.
Oh boy. All right. Let's talk about let's talk about some things that I think people are not going to groan at. Ortho Express is one of the reasons why we brought you in for this podcast, and it is amazing to see right now how many of these urgent care type facilities are popping up. Sure. Not only for general medicine, but I've been seeing the billboards for the dental urgent care, which I can't believe is a thing. And so now Ortho Express, or an ortho urgent care. Mm-hmm. And so my first question that pops up with this is, well, what's the difference? Why would I come? I broke my arm. Okay. Mm-hmm. Would I come to you, or would I go to urgent care first?
So typically people will choose for themselves. Obviously, they don't know exactly what's going on, but if you feel like your arm is broken, come to us. Now, the alternative to going to the ER is speed. That's the biggest thing.
Of course.
Ortho Express is an orthopedic clinic where you could walk in and we can expedite your care. And we have all the specialists in that building, and not necessarily you're going to come in and you're going to see a specialist, but the trained nurse practitioners and advanced practicing providers that run the Ortho Express with me, they know exactly what this person is going to need for a follow-up. So instead of going to potentially an urgent care where they say, well, we'll just send you up to orthopedics for a follow-up, where you might need a very specific podiatrist or a back specialist. So we can evaluate you and very quickly determine, well, we'll get you in with them the day after tomorrow. So it's not necessarily an emergency room, because if you're going to the emergency room and you got an orthopedic issue, you're going to touch base with our trauma team down there, and they're going to take you to surgery. But this is a great intermediate step where you can get a little higher level of care from the urgent care, but you don't really need that emergency room.
Where is the Ortho Express located here for people that don't know?
Yeah, it's just at our office, the Orthopedic Specialty Hospital, right next to Black Hills Energy on Chadron.
All right, perfect.
Yeah, right on that corner.
So then you kind of touched a little bit on the benefits of being seen at an Ortho Express. My concern, my worry would be like if something happened to me, I don't know if immediately I would know, oh, this is something that's orthopedic, and I should go to see you.
Right.
So, how would somebody listening to this podcast right now kind of know that or differentiate?
Well, the simple answer is they don't.
Okay.
But the added benefit of having a primary care sports medicine physician run the Ortho Express, which I do, allows us to have all that primary care specialty training coupled with orthopedics. and then very quickly determine, well, maybe you don't need to see an Ortho Express or you don't need to see a specialist here. And then we can make a determination from there where they go.
Okay, that makes perfect sense. Now, we mentioned earlier that you're a team physician for the Hard Rockers. So what is the kind of the role of sports medicine, a physician like yourself, in a situation like this, right?
Yeah.
When it comes to the Hard Rockers.
Well, for sure. So Dr. Humphreys and Dr. Metzler, they are also head team physicians. Dr. Metzler is primarily I would say the main head team physician.
Okay.
Because she's got a clinic out there. I am in the orthopedic specialty hospital 5 days a week. And I see patients that have any number of issues from just pain to sports injuries. So we have very different roles. So she really takes care of a lot of the athletes, and I help do a lot of sideline coverage because there's a ton of sideline coverage that we need
I'm
to
sure.
do. So I help in that regard, and if there's a specific type of injection or treatment that Dr. Metzler or myself feel like an athlete need, then we get them into the clinic. So I'm kind of like a non-surgical orthopedist.
Okay.
Where if they need a little bit higher level of care, not surgery, but they're not going to get better with physical therapy, or they need an injection or a treatment, then they come to me.
Okay. Has there ever been anything on the football field or whatever sport maybe you've worked that you were like, boy, I didn't think I was going to see that today?
Oh yeah.
Have either one of you come across stuff like that where you're?
I mean, I've done boxing here in town.
Oh, really?
Lots of coverage with MMA fights. And we've had cardiac arrests.
Oh
before.
My goodness!
We have to do CPR on people, and those things are 1 in a million, chance. But
how do you? Speaking of something like an MMA fight, where it's it's punching, it's kicking, it's wrestling, it's the whole thing.
The intent is to injure.
Yeah. How is it possible generally to keep people that participate in that safe?
Well, we do pre-participation physicals.
Sure.
And that's really the first step is we've got to make sure that these guys, have normal vital signs, and that we do a quick eval, and they've got heart and lungs, and, and they're physically fit.
Yeah.
And they go through blood testing, and they go through rigorous training. And these guys you're not going to get in the ring with somebody unless you don't think that you've
exactly
done some training here. So
what I'm saying is you and I are not going to sign up for that this
definitely
weekend.
not.
Okay, very good.
For sure. But, when that fight starts, you're essentially just anticipating, an injury. And there's EMS, there's providers there where if we need to quickly escalate something because there's something going on, then we can. And we're sitting ringside. We're right there looking at anything that could go wrong. But yeah, we've stitched up people. You had to look at broken bones, and so it's the whole gambit there, and that's why you have to have access to doctors quickly if you're having an event like that.
Well, then, Kayla, what's your role in helping Dr. Harper then? What's a day for you?
So I have been doing some Ortho Express coverage, which is great. I can help kind of get patient to the next best provider or best step. And I think a lot of Ortho Express too is education on how to appropriately rehab injuries. I think that is a big part of our job. And then I do a lot of follow-up care, post-injections or treatments, specifically 10X, and kind of help guide that process.
Okay. I know 10X is going to be the next podcast we do with you guys, and I'm kind of excited to get in and talk about that.
Me too.
When you guys decided to do this, both of you decided to do this specific field of medicine, does anything gross you guys out? I mean, I'm always so amazed at...
Yes.
Well, like what? What kind of accident, orthopedic-wise, would make you go, oh, man, I can't go and...
Well, there's a specific reason I'm not an orthopedic surgeon.
Okay, but you still see when the
Oh, yeah.
when the legs going the wrong way.
Well,
right?
yeah, and you do the same thing you just did. You cringe. You're like, oh my gosh, that's horrible. But yeah, then you quickly, okay, we got to stabilize this. We got to make sure blood flow. We got to. So you jump into a role that you've been trained to do. But yeah, you cringe as soon as you see that stuff.
Oh my God!
I don't think anybody doesn't cringe unless they just don't.
There's
they
totally
don't feel.
no feeling feelings at all. Well, it's very nice. I mean, it's awesome actually to have something like an Ortho Express in a town like Rapid City. You know, we're second largest city in South Dakota, but we're still not a large city.
Right.
You know, so when people can have these kind of accidents, when they can, for some odd reason, decide to fight MMA here in Rapid City, and you know they've got kind of a place to go, which is great. So it was awesome to talk with both of you, and I know, like I said, in the next podcast that we're going to put out with you two, we're going to talk about 10X, and I've got a lot of questions on this. Speaking of things that kind of made me cringe a little bit, was watching some of the videos of that stuff being done. All right, Dr. Hollan Harper and nurse practitioner Kaleh Knutson, thank you both for coming in and talking with me.
For sure. Thank you.